Real loud, brother, please.
My name is Antonio, and I'm a sociology major at Ventura College. And yeah.
Thank you, brother.
And I'm Debbie DeBreeze, and I'm so excited that we're coordinating and coming together for so many different groups and individuals with our hearts open. Kathy Ali.
So get your butts over here and dance. I'm Armando, okay?
I'm Benny Creighton. I'm with Ventura County Health Department, Aquaculture Programs, Prevention Services.
I'm Miguel Valencia, and I'm a world musician, also with the Arts Council here in Oxnard. That's fun. This is the man right here.
I'm a ventriloquist. My name is Felipe Flores, and I was the artist in residence here 15 years ago. So I'm just on the team. I do visual arts and music and art.
Renaissance man.
Yes.
I'm Mary Sowers, and I'm hoping to start Fuller Seminary in Pasadena in the fall, intersection of domestic violence.
One of the founding members of the Colectivo Toro por el Pueblo, and I'm here at Brother Armando's invitation. We've also had members at some of the previous meetings, and I'm just here to really check it out. I'm highly underemployed, and so there's a good chance that I won't be here next week or the week following, but I hope to be here and work with you all, and I hope that our efforts can possibly interlock, because I think sometimes there are mischaracterizations of some of the work we do, agitating and that kind of thing, and there's more to it. And so I think that we're here looking for community-based solutions to some of the problems that are ripping into our families and into our homes and into our personal lives, as far as mental health and the way that whole paradigm is kind of depicted and treated, where often the cure is worse than the disease itself. And so I'm here to learn, I'm here to listen.
Jim Gilmer, member.
Melissa Fair, member, different.
A few little notes, guys, before we get started. Jaime is going to come in, and when he comes in, he comes in. If he does, if not, we've got a lot to do, guys. Number one, guys, expediency, just research, due diligence, taking care of business. You guys got to read our emails, okay? Old school, paper and all that bullshit, gone. Phone calls, call me, didn't call you. What's your code, Debbie? Well, if it's, how do you do the telephone protocol? Put it on then? Tell me what the, okay. Anyway, we're not doing that anymore, okay? Read your emails. You want to get in touch with me and Debbie, call me. And I'll somehow figure out a way to get in contact with you guys. Email me, do something. I can't be chasing people. Won't be chasing people anymore. Can't. Too much on the line right now. And then it gets to be, confusing, delicate, and then we have to go back to square one, and we lose a lot of momentum, and we lose a lot of time. So please, and Debbie's always kicking me, slow your roll, homie, slow it down. Hell, Felipe almost died last year, and I almost died last year. Fuck that. We haven't got time. Excuse me. We gotta move, okay? We gotta move. And so, please, don't hit me up with, stuff like that. We've got to do our own work, and we've got to, more than anything, do our research. And if you go into the internet, everything that you want to know about mental health and why we're here today is there. There's a resounding amount of research that says there's no service available of any consequence for anybody in this country, but people of color, forget it. And the shit that they're throwing at us is absolutely, as Elliot said, eloquently said, it's more poisonous than maybe we want to even deal with. So we have to develop our own modalities, treatments, and then we have to demand that the institutions use them and fund them. And I think that that's where we're at right now, okay? Right, Jim? Okay, so with that, Jim, and then Debbie, and then Benny, and then open it up for discussion. And if you can leave the speakers have their little presentations, because they're kind of brief and to the point, and then we ask questions kind of at the end, okay? So, Jim, please,
And
from
not to
Sacramento.
be discouraged to my family here, but I just had a back adjustment, so I have to, that chair is not good for me right now.
Okay.
So I'm gonna just stand up and just very briefly, I apologize that I have to leave early today, before 6:30, so I just want to give you a heads up if you see me pass out that way. I have another appointment, but supposed to give you like a Sacramento update. What Armando just said, what his brother, what was your name?
Elliot.
Elliot, oh, okay. Just mentioned, we're about our coalition reducing racial and ethnic disparities across the system, not just mental health, but all the system. But we're here particularly around, mental health and some of the other areas that we deal with. This week in Sacramento, we had a very, very, very important Senate hearing because it brings us to an equal place, this role that we have, what we're trying to create in this coalition is cultural brokers, promotores, community health workers. It's, those types of terms that we use to say that people like yourself, people like me, have a role in seeking my own pathway of healing. And we're the experts in that area. There's a whole other system out there, an institution for many, many years, as long as, we've been around this country and so on, that has what they call, an old paradigm, a consumer, a client, a peer, and that's a Western, language of how they seek treatment. And in our communities, we don't use those terms. In some communities, they don't even identify themselves, even say mental illness. They don't even use those terms. And so what we're attempting to do is to get cultural broker, promotora, etc., actually where we are trained, certified, and get paid to do it. And you can actually build Medi-Cal for that. Would you imagine we have a whole army of cultural brokers, promotores, community health workers coming out of this place, and the transformation we could do in our city, in our communities? That's the fight we're taking at a policy level. And we've already got this going through here. I just want to bring up to date on that. There's more hearings because there's a whole push to not have us there, to not have you represented at that table. To keep things the same old way, same organizations, get funded, do the same old stuff, and none of us get any better. So I just want to update you on that. I'm sending emails out. I know it's a lot, and as Armando said, just to keep you abreast of what's going on. We each have our areas of where we're doing things and advocating and so on. That's one area that I'm focusing on. And at the same time, there's going to be some state money coming down in July that we need to be ready for, because the local money and the state money, I'm going to tell you, it's going to be a rich sort of capacity building for our coalition and for the various population groups. Those RFPs, samples are already out. And you need to start looking at those, and maybe at some point I can give a presentation on those RFPs to kind of see where we're going to fit, because they're going to fund coalitions and they're going to fund coastal-specific programs. So if you look at the 5 populations, Latino, Asian Pacific Islander, African American, Native American, and LGBTQ, each of those areas are going to get about 8 to 10 grants, $250,000 each. And I think we're primed because, let's face it, we've been doing a lot of cultivation up there from this city for 5 years, and we have the inside information. We have a great team here. There's no reason we should not be able to get one of those grants, okay, as well as the local stuff. So those are some of the big things we're working on. Other than that, just working with Armando on the whole crisis intervention team stuff. He can report on that later. What else is I think that's about it on Sacramento. Yeah.
We're talking, guys, hundreds of millions of dollars in this capitalist society. So it's not about getting people well necessarily. It's keeping them sick and then maintaining that pot of money. So what we're talking about is addressing ourselves in such a way that we make ourselves better, our communities better, but we're also entitled to that money because we pay taxes. And that's where, I shouldn't say we'd be fucking stupid not to go after it, so I won't say it, right? But that's what's happening.
Yeah, I got one more thing.
Yes,
too.
go ahead.
I did send to Debbie, and I wanted you to look at it first, and Armando and Anna, I think. At the back, we did an African-American report, which is about 300 pages, and I couldn't download it and send it to you because it's too big. But that particular report, what I referenced was the appendices that has the surveys that we use. It has the community-defined practices survey, because at some point we want to inventory what practices and programs we have in here. So I just wanted to mention that if we can maybe bring samples to our next meeting, if you haven't done already, and we can start inventorying programs now.
That's part of the due diligence, guys. And when I
Yeah.
say due diligence, maybe I should say just do
Okay.
the shit
So
that
maybe you and I can coordinate
we're
on that?
requesting you guys to do. A paragraph
Yeah.
on the stuff that you're doing in the community right now. And let somebody else decide whether it's working or not. You can say it's working, and it becomes valid. Just by saying that. My shit works. Autumn is doing the photographing thing, and
Yeah.
that's working. Julie's dancing, that's working.
Yeah.
Jackie is
Yeah.
doing what she's doing, that's working. We gotta validate ourselves, they're not going to. Get it, guys? They're not going to. But the point now is that we've gone beyond that mark. We don't need their validation. Debbie and I have been doing this thing for 50 years together, trying to be validated. Generally speaking, so we could bring services to community. Well, it's taken us 50 years, and it's taken Jim 50 years, and it's taken Benny 25. The brother's much younger than we are. But it's taken us that time to get validated, right? But it wasn't us. It was they built their house on sand, and it's falling apart, and now they need our help. So that's where we're at. Debbie, go ahead.
Okay. A couple of comments. First of all, I've been emailing to everyone, and I always get returns. And I obviously am not reading exactly what you've written each time. So let's just make a rule. If you don't get an email from me by 3 o'clock on Saturday, email me, so I'll definitely have the right email. Okay? Because I've asked people in the email, if you see an address that isn't the right one, please forward it. But we want to make sure everybody's in the communication loop, and somehow I can't always read everything that's there. I want to say a couple of things, but my part of this is really about the survey. The first thing, though, that I wanted to mention was a report on, again, what we did last week when we went on Thursday on the 9th to speak at it's called the CLC, it's a Community Leadership Committee, and for behavioral health. And as we reported last week, it was a very positive day, primarily because we were introduced by the supervisor who was so pleased with
Behavioral health, Debbie, at Ventura County, right? So give us the breakdown.
Okay,
Ventura
so
County,
basically, Ventura County Behavioral Health was having a meeting about people from the community who have been on an advisory board for years. And we went specifically at the suggestion of some of the top people to present what our coalition here is working on, what our goals are, and what we've done so far. And hope that, not the hope, in the step that then we would be able to apply for funding to specifically support the separate groups that are seeking data, community-defined practices for the information, and that we would become a viable force according to the statistics of the Behavioral Health Department. And so we had a little bit of confusion of how we should first approach this. Should we have a large group go and demand, or should we present what we've been doing, or what? And after we spoke with the supervisor who was here, he suggested that at that meeting they weren't going to be able to make a decision anyway, and it would be strategically wiser for us to tell briefly what we're doing, almost like a teaser, and then to request formally that we be on a future agenda item with time certain. And so before we even spoke, John Zaragoza talked in high praise about what our group is doing. He spoke for about 5 minutes about that. And then, ironically, after that, even the chief of police said the types of solutions that we could come together with the groups here would be very viable. And so she was supporting specifically what's happening at Cafe Arne. And so then Jim came up and shared the specific linkage to all of the official committees that are in Sacramento that are investigating and the historic work that they've been doing. And then I just briefly shared what we're doing with our coalition and what our specific goals are. And the way I said it was we're trying to, no, I didn't say trying, but we're working to find what works in mental health for the different specific cultural groups and what is not working and what is missing. And we're doing that by using the newest form that's accepted in academic circles, and that is to use community-defined practices. So that's exactly what Armando was referring to a few minutes ago, to say we need each of the members here who are representative of groups who've been successfully working in a community over the last years to document what it is that you have been doing and write down even just a brief summary. Some people have sent me a paragraph, some people a little bit more. We're gathering that together so that we have a compendium not just of theory, but of actual practices that are working. And at the meeting, one of the things that was a result was that they were saying, we really want to go from theory to using programming that works. And that's going to be the therapy modality that we're going to be using.
Sure.
So that's what we've been
So
pushing.
stop right, just for 1 second, Debbie. Best practices, tell us what that means, because that's a new term.
No, okay, well, I think some of you have heard this before, but in previous years, when we wanted to apply for a grant, many organizations from the city to the county to probation would say, the way we fund this is on your evidence of best practices. And that was the, quote, term of the decade. And it meant basically that you were comparing what you're doing with what has been called out around the country and has been determined to work. But it's been sort of stamped by, and I guess I would say academics. Then after best practices, there was a new flavor. And that new flavor was the word best evidence. And again, that was relying on academic validation of mental health services. And I think I'm an academic, so I can be critical. But,
bullshit.
But the fact is, there's no touch point where that's connected with experience and what really works and what new ideas would be possible that aren't written about in a journal. And so the new term, and the reason we're so excited that we're all gathered here, is because that new term is community-defined practices. And that changes the entire process because there's another door open. And it's a door that will help us connect directly with the work that we've been doing that is helping people who are hurting and having issues. So basically, that was
So
the main
Debbie,
part. Let me just finish.
just 1 second, okay, Debbie? The best practices was not opened voluntarily by the institutions. They were drowning in their own shit, in their own mendacity, in their own incompetence. And as a rat runs up the plank to try to save himself, that's what's occurring now. And so that's the hole that's been opened for us. The ability to now demonstrate, for example, just a clear example, I go to a clinician, I come out feeling more fucked up than when I went in. But then when I go dance at Julie's place, I feel better. Best practices, okay? That's just as valid. And it's community defined. That doesn't get any money. This fool over here that made my head hurt more gets $120, $250 an hour. We got to change that paradigm. That's what we're talking about. This is very serious stuff, guys. And for the first time in 50 years that we've been doing it, it looks like they've said oblado. They've just said uncle. And so now it's up to us to be able to make sure that they don't well, first we can be co-opted and all that other stuff. We can be sold out. There can be a new flavor of the month brought in, and they're going to throw that shit at us. So we got to really stay together, okay?
Okay, but the main part that I wanted to do is give you the summary of that was up to that point. And then after the meeting, the feedback that we got was the people that were in charge of that committee meeting valued what we were doing so much that they didn't want us to come on the agenda for this large group, which would then filter us to go to the small of the committees that are actually recommending funding. but to go directly to those small committees. And so that part of it is that they were looking up what we've been doing, they've been watching some of the great videos, they've been participating in the fact that we have an active group of people who are already defining community practices and already is a representative group that hasn't been included yet. And so it was very exciting as the feedback afterwards that what we were doing was something that door is opening a little wider. Now, just specifically, I wanted to share briefly a couple of ideas for the survey. And the piece that I wanted to share is my goal is that by the end of this session today, we'll have this brief discussion, and then we can break up into what we were saying, almost like a mini salons, maybe to talk about, and then some of the questions that I'm going to bring up that have been gathered from some of the surveys, or specifically what's working, what's not working, what's missing in each of our specifically defined groups. And we probably want to do black, brown, and then I'm not sure how we're going to divide the other grouping, but it could be potpourri or something if it's valid, because
We can call it what it is, Debbie. You self-identify. If you're a gay, lesbian, you want to do that, cool. You want to be a pinto, you know.
But the problem is, and I say the challenge is that we might have one of a lot of different groups, so we're going to need to have some way to have a discussion. So I want to do that. Let me just share briefly. Ana Barba, who has been trained as a first aid and mental health coordinator for the crisis team that exists, she is doing a crisis thing today, so she couldn't come. But we also had a chance to look at some possible questions. If you don't mind, I'll just read some of those to you. Some of the ones from the reports that Jim basically said to see if they stimulate any thought. And then just to remind you that when we were there at the meeting, we got the community membership profile survey, which we already have, that the county uses, which has, it would probably be an appropriate backup for anything that we did. And I went over this last week, so I'm not going to redo that, but it's basically asking what demographic groups an individual would identify with. Again, the whole goal of this is to have a tool that is flexible, porous, and basically for each group fairly consistent for being able to gather the community-defined practices and where those gaps are. So specifically in the one that Anna mostly did and I supported her on, we had a couple, it's just a page and a half. And it's, I can send it to everyone with the minutes for tomorrow, but it's basically, please take a few minutes to fill out the survey on the quality of services for mental health you or others have experienced. And then we decided we needed to give a definition for mental health, and that's one of the first things that each group probably will want to, I don't know, touch and make a little better. Well, we said mental health may be identified as having or expressing symptoms with depression, emotional trauma, anxiety, psychosis, substance abuse, or even eating disorders. To better meet the needs of our community, Oxnard MultiCultural Mental Health, or the Organization for MultiCultural Mental Health, seeks your input and your answers, and they will be kept confidential. Thanks for your participation. And then basically just 5 questions. Have you or someone you know had a mental health problem or crisis? Yes, no, or don't know. Do you consider a mental health problem serious? Yes, no, don't know. What do you consider to be a serious mental health problem? And then how often have you or someone you know sought help or services for a mental health problem within the past year? And then the number of times. And number 5, if you or someone you know were having a mental health problem and did not seek help or services, why not? And that's helping to identify the gap. Then under seeking services, we have also, this time there are 8 questions. They're simple. Would you know how to help yourself or someone in a mental health crisis? Yes or no? Did you know who to call for help or services with a mental health crisis? Yes or no? Was the person able to answer your questions or guide you in your appropriate language? Yes or no? If you did not know where to seek help, who would you call for assistance? And then we have fill-in. Doctor, family member, or friend, other. Number 5, if there were a crisis situation, who would you feel comfortable calling? Crisis intervention team, police department, other. Number 6, what in your opinion is the reason someone would not seek help for a mental health problem? And number 7, do you feel the health fits with your family ways to share and talk to people? Yes or no? That's a cultural blend, but it could be worded better, probably. And number 8, could you comfortably share and talk about your issues to get help? Yes or no? So we have some basics. Then from the
Stop right there, Debbie. Let's stop right there and let's have a discussion because.
Please, I want to finish
Okay.
this, okay? I'm sorry, you guys, it's a little bit long, but I want you to hear the other range. These are ones that are, what we want to do in our individual groups is be able to come up with the questions. Okay, so all we're trying to do is prime the pump to have everybody understand roughly what we're looking for. And I'm totally at peace if you say these are horrible, I hate these, let's do something else, but we need to start so that we have something soon.
Yeah.
Okay, here are just a few others. What is it like to be a member of your ethnic group in this community in terms of seeking help for mental health? Okay, and that's to try to stimulate bringing out thoughts, obviously, on how it exists. Is your community and local area, what does mental health mean to you? Do you think men and women have different issues? That's a no-brainer. Okay. What strategies would increase mental health in this community? Do you know of a way to reduce community barriers to mental health for your group? Can you make 2 to 3 recommendations of services to aid your group? And list a new mental health program for what type of establishment will we need for mental health programs to enhance the services now being provided? Okay, so those were just fairly solid establishments. So what I'm proposing, and I think all of us would like to do, is in a few minutes that we would break into self-identified groups and then basically reformulate some of the questions that we think we can ask and then respond to some of the programming that's already being done. Yes, Jim, sorry.
Yeah, I would just on overall listening to the questions and having worked with all these communities before, the term mental health is not, as I said earlier, appropriate for many groups.
Well, I
So
think that's covered in one of the questions.
let me finish my comments.
Yes.
The focus would be how do you perceive wellness and resilience?
Excellent. Okay, great.
Yeah,
Can I add something to that?
Yeah.
Those questions, some of them are leading,
Mhm.
and when you're asking them, I think we need to be very careful not to try to give them the answers.
Okay.
Yeah, so
And some of them are visiting the institution more than the patient too.
Okay,
Yeah,
great.
I think that the questions are boilerplate, there's something to get a discussion going.
Yes.
But what I heard was, what is that broken down system gonna do for me? How do I reach out to that system? How do I, fully knowing or not knowing, but what we're trying to do here is trying to assert that the answers are probably within us and within our group, not over there.
right.
So all those questions are jumping back into the shark-infested water. So we can't do that. We can't do that. So we see that when they give us documents like that, it's a setup. It's a righteous setup. And we can't buy into that. And we can't buy into being set up in this room either.
Yeah.
We can't be set up.
I just
Yeah,
want to say
go
one
ahead.
thing. A lot of those questions I got from that community-defined solutions for Latino mental health care
Yeah,
disparities.
right.
And I know it's much like the black one. Yeah.
It's very different than African American.
Yeah.
The Latino report, unfortunately, was an academic report.
Okay, but you guys, the main
Yes.
reason that I wanted to read
Yeah.
this is so that we begin.
Yes.
Because all we need to do, we can throw all these out and tear them in 100 million pieces.
Right.
That's not the important part, but we need to have something down. And I've been asking for people in the community, or we have, I'm not me, we've been asking for ideas, and we haven't been able to do it. So if we have a little bit of time that can be structured for that, and you can say, this is terrible because of this, great.
Yes,
Okay, so
yes,
what
yes.
can we do next?
But I'm gonna give you just a quick backdrop. I know I passed that Latino report out to you, and I should have probably pre-qualified it. And I love the author and the person who's behind that, but it was another off-the-shelf report, okay? It doesn't really speak to a lot of the grassroots stuff, and I'm just gonna say it that way. You know,
But see-
I'm on the wouldn't write it that way. You wouldn't write it that way.
Well,
okay?
but look, Jim, this is why this is so great.
Yeah.
Black man talking to a Mexican, you know, a Chicano. Wonderful. At some kind of level of power. And, you know, a sister that is as strong as she can possibly be. This is what community is.
Yep.
This is what wonderful community is. And we're seeing that some of that stuff is shit. You know, I read the report. You know, so I want to be critical of a Chicano report. You guys be critical of black reports. And you guys be critical of gay reports. And you be critical, or we can be universally critical of everything, and we're just critical about everything. So what Debbie is saying is, we got to get on the pot and do something.
Is that how I'm saying?
That's how I'm saying it. You know, we're priming people, you know. Come on, send us those synopses. Send us those this, send us those that. Show us that, you know, your practices are working. You know, I'm going to call out the artists, you know, the brothers that came in with their stuff. You know, they're not here because they're out doing stuff probably. But still we have to have something in writing so that we can present somewhere, because that's the only way we're going to get money. We're not going to get money by somebody dancing or Felipe painting something, or anybody painting anything. We've got to be able to document something and present a proposal.
Yeah, one overarching question.
Yes.
Okay, that I would put,
Yes.
and to see if this resonates, is how do you define wellness?
Okay? Okay, we can break down into groups and pass that one and have a salon, right, Benny? Yeah, go ahead.
For me, that's junk. That's a problem for me.
So tell us what you would do first, Benny.
First of all, I would think in terms of, how do we avoid the system? We don't want to get there. They've already labeled us criminal, insane, mad, immoral. We want to reject those models. We are not crazy. We are not immoral. We are not stupid. We have something to say about what's driving us together in this environment. When we meet in the social environment, we find that it's poisonous. It's killing all of us.
Yes.
And we need to name what is killing us.
Great.
What is killing us is the system that's America, that's the Western world. And that is the racial prejudice that exists here. We need to recognize that and call it what it is. It's a poison, it's a toxin, and it's making us sick.
So how do we do that, Benny? Do we do a manifesto, or how do we do it, brother?
We get together and we talk to each other about that fact.
Okay.
How is that impacting you?
Okay.
Do you feel what I feel?
Okay.
How is that causing you or setting you up to behave? Because all behavior has meaning. It comes from someplace. And where it comes from has to do with what's going on with you and around you in a social context. So can we understand that? Can we understand it together? How do we understand it together? We come together and we agree to discuss that issue as an issue. And the issue is not the kind of things we need, but how can we avoid those systems altogether? Because we've already programmed us to go into those systems. You go into the mental health system, you go into the criminal justice system. And you've already decided that you are not a real human being. We know who you are, and we despise you, and this is who you are, and this is what you're going to get.
Benny, can just for the sake of, you know, consensus and, you know, democracy with a little d, can we all agree with a brother? I mean, if I had 5 hands, I'd go like this. I'm in the agreement, but I don't want Benny talking for anybody that doesn't agree with that, right? Benny is preaching hard and agree, and in total agreement. Do we agree that that's the conversation that we need to have? That the system is broken?
Yes.
And more than that, it's toxic?
Yes.
Or you know, wherever we need to go. And then break out and talk about that.
Yes.
Can I just ask
yeah.
one question? I think our goal is to eventually be able to get funding to sustain what we're doing. And I'm just being practical.
We want to get the right kind of
Yeah,
funding.
I agree.
The way the funding itself is set up, you got to be crazy
No,
to get funded.
but respectfully,
We want to
if I could just finish just for a sec. Okay, the idea is we can talk about what's not working and who we are and what the issues are, but eventually we need to put down some method for being able to gather that information so we can help community define.
And we can do that.
Okay,
We can do that through the salon process.
okay, that's why I just want to make sure we have a.
Well, you two academics, I've already told you we got the answer. Fuck all the academic shit. You know, let's dance, let's paint. Let's, you know, that's what I'm suggesting. And that's where we're already valid. So what we're doing is we're trying to play this little game. And what I'm suggesting is that we've already got community-based practices that work. Now, how we get funding to expand those practices, that's the
That's
issue,
where
right?
Debbie and I, and Benny's saying the same thing.
Yes, yes.
He's looking at future on, but we can begin some preliminary surveys around some basic information, just to get, we would like to even have that when we go do our presentation.
Right.
That's what she's going. You know,
Yes,
doesn't mean we're not gonna dig deeper in the bucket and,
Yes.
and do.
I just
we're-
want to have an end product.
Exactly.
Yes, so there's parallel tracks going on here, is that, or
Exactly.
multi-tracks going on?
Exactly.
Okay,
They come together, those points comes together because the value of what David was demonstrating through this paper is that we define by the system.
Yes.
So we also need to speak the language of the system to be able to define what we want.
Right.
So they go together, they're not isolated.
And we
But
can.
I agree also what Armando said.
And we can speak that language.
Yes.
We have professional people who have defined, who have put that language out there for us. And all we have to do is understand what they're saying and see if we agree with that.
Yeah, but I also agree with Armando said, that, you know, how we define, because we're not gonna follow the definition of the institution, whether it's for black, whether it's for Mexican, Hispanic or white or whatever. The system is a system. Human beings don't fit in the system, never fit in the system. So, and having, you know, new ways to address the mental health, like Armando was suggesting, you know, living things, you know, through art, through sport, through different things. I know myself that with the power of any of them, you know. So I think both need to be addressed. They go together.
See, the other thing that in all those 5 population reports, and I'm not criticizing that as being a report, I'm just saying, when an academician does a report, you're gonna get academic perspective. When grassroots people do the report, when you look at all the different, each of those reports are very different. Even though they're from, you know, populations of color, because of who did it. And the ones like us are gonna be more accurate to what we wanna do, you know, and are gonna translate things and articulate things and say things the way I would say it, the way you would say it, and you would, you know, probably identify with that. That's what we want to do.
so, 1 second, if I could interject. We need a survey. We need data. And we can reject data, and then we're probably gonna have a longer fight to get to being funded to continue to expand. Funding isn't driving us, but it's a critical factor.
Yeah.
It's a critical factor.
It actually shows respect for other agencies for what we're doing, and so that's.
At the institutional level,
Yes.
right? And right now, we haven't got any of that. We certainly need this brother's genius about, you know, the
Drilling
whole
down.
system,
Drilling
the way he
down.
breaks it down,
It's drilling down.
the way he drills down. You know, somewhere we gotta be brave enough to reject this poison, because it's killing us.
All of those questions were not bad. All of them were not bad.
Right.
Okay.
Some of them I
Yes.
wrote down, and one that really caught my attention is, do you know who would you call for help?
Yes.
That's a
That's a
big
good
one.
question.
That's a big one. And then the other one is, what is it like to be a member of your ethnic group in this community?
Exactly.
I wrote that one down
Yes.
because that's a great question.
It is.
Because we're all having different experiences based on our frame of reference on how we were labeled on our birth certificate.
Yeah.
And how you.
How does
present
that
your-
affect
how-
the
how you-
outcome?
How you present yourself.
How
in
does
this
that affect the
culture.
outcome?
How does it, what's the outcome?
Yeah, I mean, basically the goal is the same. How does it affect the outcome?
I'm not really sure what your question
Yeah.
is.
I don't know. I'm sorry.
I didn't think
really
anything
would
was
think it'd be
finished yet.
a real sad thing to isolate groups. And I think it would be as equally a sad thing and a lack of communication to generalize groups too.
It is.
But don't you think it's more to
Because we have a
reach
lot
the
of ethnic
groups and
groups
then-
in Oxnard.
Mhm.
We really do.
Mhm.
So let's stop isolating them and start treating them as Oxnard.
Mhm.
That's what we're doing here, brother.
I agree.
That's the whole point here.
I totally agree.
That's the point here. And one of the things that we have to do is we gotta show up every time so that we can stay in the loop. Or at least read the research. Because we gotta stay with what we're doing here. We really, it's very important to stay with what we're
Now
doing.
that you submitted your question, then you can go, because I don't want to spend 45 minutes with people's questions.
Yeah.
Let me finish my comment.
Yeah.
I think, Debbie, you have given us, you primed the pump,
Yes,
okay?
yes.
And we're not gonna have a 50-question thing. We're not gonna do this in this first thing, folks.
No.
Let's just take Debbie's questions, and we can do this in our homework when we go back, because now our interest is piqued. You've done it, you've accomplished that. You wanna add a few questions, or you like some questions? Why can't we just do that through email?
Sure, can we get that back next week?
Okay, well,
Can we
If you
get
wanna
that
ask
back next
another
week?
question, sit them in.
Yeah, you make
Okay.
5-page documents.
This is just,
Do it.
this
Do
is
it.
just to get us started.
I just want to say, I've been asking for, we've asked for questions for a while, and we're not getting them.
People
So
don't-
we
right,
wanna
right.
do
People
something
don't know what
still.
question to ask.
I know.
So they're not primed to ask the question. So they have to be ready to ask the question. What questions should we do ask? The questions that you answer, where you raise some up there. How does it feel to be who you are in this community? What's happening with you? What are you doing about it?
Right. That's why I was suggesting that we
Very good.
break into small
Yes.
groups for a little bit, just to see if they're.
Okay, so let's do this, just for the sake of clarity. We all agree that Debbie is gonna get your emails. Please give them to her because it's very important. Debbie's gonna respond like tomorrow's sun, okay? She's just gonna respond and get that shit out to you. You guys gotta do your homework, and that's part of the reciprocity. We need it. Whether it's right, wrong, or indifferent, we're gonna clean it up through transparency, through deliberation, honesty, and all that stuff. I think that we're getting to something. You know, the old adage that, genius is never lazy. Well, neither is good work. Ever. We gotta do the shit. We gotta get busy. We gotta do it. So please do that. Send in your little blurbs about community-defined practices. And nobody at this point about surveys or anything else is labeling good or bad.
That's right.
There's no good or bad.
Armando, can I
Let me get done, Nancy. Let me get done, okay? Let me get done. And I need you guys to be able to do that. The other thing is that we'll be very, very limited in time, and we're not going to be burping people as they come in. We can't do that. We're not going to have discussions that we had 5 weeks ago. Won't do it. So if you think that that's, rude, then everybody knows where the door is. We hope that you don't take it. But we're challenging you because this is historical and we're moving forward. Enough of this poison that we're getting. Okay, so now we're going to have a little tiny discussion, and then we got to talk about the cop issue and how it's affecting us here, and how it's pressing down on us, and how so many important institutions, powerful institutions, are fighting for some piece of what is going on here. Okay, so Benny, your turn, okay? I'm sorry, did you want to say something now?
Yes, there was a criteria that wasn't mentioned in the last week when we were making labels like you were labeling the groups, and one of them is homeless. I don't know if you
Yeah,
want to even
that's
consider
fine.
Yeah.
that or not.
Yeah, that's great. Homeless is great.
So I won't have to talk, and so you won't be confused about what I propose. I'm going to show you, to tell you what the salon is all about, and then I'm going to give you some information about the history of the salon and where they come from. I'm going to pass this around to you. It has two sides. You can look at both sides, and then after you finish reading those, then you probably have some questions that we can talk about at some other time. Not here, not now, but at some other time.
Okay.
I'm also going to pass around.
Yeah, I'll send it.
I'm also going to pass around a way of doing that, and I got a lot of read the rest. If you don't get one now, I got 10 of these, so don't worry about it. But I'm
Benny
saying.
always comes with a lot of paper.
I'm saying that the way to get started is to have something real. And I'm calling that a salon, and people that are coming around now will explain to you what a salon is.
Respectfully, Betty, is it one-sided or two-sided?
It's right here, first page is here.
Debbie came up, can we pass them?
Debbie,
Debbie?
Can
you send that to me?
I only got one, I need to keep it because I'm gonna scan it and send it to everybody.
can you send it to me?
Yeah, I got packets here that
Can you
there are
send
5 or
it
6
to me?
pages
I
here.
will, I'll send it tomorrow.
When you get yours, this is the one to look for that I'm proposing, with a place to start. And this is how it's going in us. We have a theme for it. It's a review of the what, the why, and the how of effective prevention interventions, and sponsored by VCBH, ADP, and community-specific organizations of color. And the theme of this salon will be to take a message to America. The theme is, wake up everybody, it's time to build a new, healthy world. The focus is, we ain't crazy, criminal, stupid, or immoral, just trying to survive in a crazy, criminal, stupid, and immoral system. And you see a note that we're going to use the CRDP population report. That's all of them, all 5 of them. The black one, the red one, the yellow one, the lesbian and gay one, the Native American one. And you're going to use as a part of the partial place to begin the Cree Indian medicine wheels that describe the unique gifts that all of these colors bring to the world. Red people bring vision, black people bring reason and meaning, yellow people bring patience and durability, white people bring movement. And I have that the vision is e pluribus unum, and in question, when can brown begin? The Native Americans, they didn't see brown, they saw red, yellow, black, and white. So brown is an amalgam of most of those colors. So we want to look beyond these singular colors that were identified and have been identified forever, and look at the whole panoply of colors that are out there, that include all of us. Because we want to build one nation, indivisible, with liberty and justice for all. And the mission is to build a more perfect union, to promote the general welfare, to provide the common defense, and secure the blessings of liberty, plus health and well-being to ourselves and our posterity. And I stole that blatantly from the U.S. Constitution. The very papers that were written that said, this is who we are. We knew that that was a lie then, and Abraham Lincoln started the later said that was a lie, and we fought a civil war to try to prove that, make that real. But after the Civil War, we're still left with something unreal. And they're calling it now a pigmentocracy. It's not a democracy, it's a pigmentocracy. It's about color of skin. And skin color is rated in hierarchies, with white being at the top and all the rest of them falling somewhere after that. That's the reality that we live in. And we're all judged by what color skin we present to the society. And you are valued based on your skin color. And the way that you are treated based upon that leaves you feeling all kinds of ways that are horrible and awful, and makes you vulnerable to the development of disease and dis-ease. We want to catch it before it gets to the disease stage, and catch it at the dis-ease stage. That's prevention. Before it develops into a full-blown illness. We're not interested in feeding the mental health systems, those systems they created, the police system. We're not interested in feeding them. We're interested in catching our people before they get to that. And there are some things that we can do. Maybe that I've passed out to you will illustrate. We have research within those population reports. All of our people of color have done research to talk about just what's going on with them as members of those individual communities. So we want to get what they've said, what they've identified, and filter it through us in our experience here, as members of those same communities, are you experiencing these kind of things? Let me show you what kind of things that they talk about. Bacon esteem. You hear a lot about having esteem. They're saying that we suffer from bacon esteem. You don't have any.
None at all.
None at all. They also talk about a never-ending anger. Where does that come from? Do you know you have it? Do you recognize it? Do you know how to address it? Do you know who to go to and talk to about the anger that you feel and can't describe? They talk about being in a condition of invisibility, where they really don't see you as a human being. As a matter of fact, they decided that you are less than a human being. You are 3/5 of a human being. And that's the way they describe people of color, black people, in the Constitution. You are not a full human being. That was then and still now. And you see that's what's happening to you when you go out, when you present yourself in schools, when you present yourself to the cops on the street. They don't see you as humans. That's why they can gun you down and laugh about it. That's why they call you stupid and give you an F and put you in the retard classes. When you show up, they see you, they make judgment about who you are and who you can be based upon your color. That's the system that we live in. That needs to change because it's killing us. So how it's killing us together. So how do we together come and name it? We've got to name it, we've got to describe it, we've got to quantify it, and we've got to figure out how to address it. And those people that refer to you in that paper, they have ways of doing that. So we're going to take a look at what they decide, what they looked at, and see what we've developed on our own here in Ventura County, and how is what we've developed serving us here in the county. If it's not serving us, what needs to be enriched? So when we go to them for the money, we can be very specific. We need X amount of dollars to help us do capacity building so we can better serve our community who have these needs. Because you can't do it. You don't know how to do it. You've proven that you can't do it. And our people have gone to you and they have flunked out. And you have written them off as not redeemable. And we say we cannot tolerate that. So if you've already written them on it, so it goes directly to those systems again, oh hell no. We got a way to do it better. We know how to do it better.
Yes.
And here are the numbers that say it. Because we're going to count them. We're going to count them in those numbers. And we're going to measure how many we keep out of your system. And that's the way we measure progress. That's the way we measure success. We have 50% fewer people being involved in your mental health system this year. We've had 75% fewer people involved in your criminal justice system this year. We've had 35% fewer people involved in your social services system this year. Why? Because we are taking care of them in our communities. And these are the methods that we are using. And we can show you these figures to tell you this is what we did, and this has been the result of what we did. You have few of them coming in your doors because they don't need you. We are seeing them over here in our community, in our community-driven processing, our community-driven services, and they're getting the things that they need. And ain't that great? Ain't that grand? So I'm talking about coming together. That's what all the literature I've looked at says. Things happen when people come together and we talk openly and honestly about what's going on with them in their community. We find a way to name it, to describe it, to quantify it, and to address it directly.
Okay, so this is what we have. Great presentation, Benny. What we have. We have basically a thesis that is supported by a lot of work. Most recently, a lot of work. Benny has presented a thesis. He's also and you can buy into it or not. I mean, that's up to you. He's presented a thesis. It's not biblical and it's not in stone, and it's a thesis and it's his. I happen to buy into that. It's up to you guys to believe that.
Okay.
Somebody might argue also it's not only racism, it's capitalism.
Yes.
Classism. And then, then I think all of us can agree on that. But it's still a thesis. Other people will argue something else. We have to decide as a consensus that that's the thesis that we believe in. And if we believe in that, then Benny is saying he's given us a platform, the salon, to begin to discuss openly some of these prompts that will be presented to us. In a salon fashion, we then synthesize discussion and collect data from there.
No, that's a pre-package. Each person gets one.
So,
There were some people that wanted to comment. I think that Buddy and Josh and,
yeah, go ahead.
I came in a little bit late, but from what I'm hearing right now and the feedback on track, I've been around here for a little while in my lifetime, and I've been under the umbrella, I've been called many things as far as my ethnicity goes. Not just one or two, 4 or 5. And it still exists today, even with our young people, who they think they are. I'm talking about all the races, as far as knowing, really, like I heard somebody say, I have a birth certificate that says X. My children have one that says something else. And their children have something that says something else because the system has allowed to divide and conquer within your own ethnicity. And I think this is one thing that will help us out. Since we're going to try and be a melting pot, it would help as a base for us to try and identify the various different cultural names that they have given us, and say, now, out of all these 3 or 4 different names that we know that we've been called or labeled, which do this group? Take each one of them and say, this is who this group is, and then you put them labels around the melting pot of this committee to say, this is where we're going. Because right now, I still, being in this town 54 years and having friends from every walk of life you can think of, I still have to check myself to tell Gil, Gil, are you Spanish, Mexican, or Latino? But, you don't know what he would accept to make it comfortable to cut through the chase. And I think this is what we need to identify. What's going to be comfortable? And I'm talking about Ventura County. I'm not really talking about Washington, D.C. and all that. Because this group is from here. That's all I have to say. I think that's a good start.
And that's what this is about, for this county.
I just wanted to just backtrack a little bit about, you guys wanted to talk about surveying and all that. For our college, Oxnard College, we're going through elections right now. If you guys put a survey together, I'm actually the chair for the elections, and I could actually get input from adult students on this survey.
Great, Josh.
And so that'd be a good starting point, because you start to bridge at the young youth that are being affected and all these issues that are going on. You know what I mean? So that'd be something good.
You have to be careful though in doing that, because what you're doing when you're putting together a survey, you gotta remember, you can make calls, you can go door to door. Okay, what if someone doesn't have a telephone? What if someone doesn't have a home? Those are people you need to get to, just on the street. So we might want to put together different groups that do different things.
I could answer that because our college is a very diversity campus. Unfortunately, there's a lot of homeless students there.
Yes, I understand.
And I think them students are going to be actually the mice that are going to pass out the cheese, because they live out there homeless and they're being educated, so they're going to be able to feed who? The group of people they hang around with after school.
Good point.
You see that? So they're going to give that cheese to them. They're going to, oh man, let's go get involved. So I think that's going to create a big monopoly movement. So I think that'd be a good starting point. And I'm willing to help you guys on that.
That's really great. That's good. Can I just say, as soon as we get your questions, so can we ask I'm gonna send the minutes to you tomorrow. If you don't get them by tomorrow night, you email me. And if you have some questions or some that you like that we heard of or we didn't do today, send them to me by Monday so that I can have them and start putting them together.
I just value what you said. I think it needs to be addressed. But I also know that, you know, the vacant self-esteem, the invisibility, less than feeling a human being. Yes, we can do something to change the system, but ultimately, this is a question that needs to be answered at an individual level,
Yes.
on a very deep level.
Yes.
And I think in everything we do, we should not forget that, to give a
Exactly.
perspective. to it.
Exactly. At a soulful level. We're not talking about physical or chemical healing, we're talking about healing of the soul. Because those wounds that we have suffered have been very, very deep, and they have been insidious. Many of us that we haven't even felt it, didn't know that we were wounded, and still don't know it. So we had to go through a process of realizing you've been wounded. And the new literature suggests that we recognize it as racial-based trauma. We've been traumatized, and it's never been addressed.
Yeah, and we should never forget that.
We should never forget that you have a reason, you have a right to be troubled. You have a right to be angry. You have a right to be concerned.
Yeah, and we should never forget that no matter how corrupt and, I don't know what term to use, the institution is, it's still a human being. It's still a human being.
Listening to each other, that's.
Yes,
I think it's important in that survey, you know, and maybe you might have discussed that, I don't want to speak out of turn here. But I think it's important to also note, or inquire about the quality of other services. Because there are mental health services, yes, but a part of mental health is really a holistic thing.
Yes.
And that's where those ethnic and socioeconomic disparities come in. Because if you can't go to the park, kick around a ball, hit a softball, shoot some hoops, run around the track, you know, drink some Gatorade without having to go piss on a tree, you know, and then get arrested for indecent exposure, how will that affect your mental health? If you don't have access to recreational services, if there aren't, you know, venues where you can go to dance, to sing, to play in a band, you know, you're probably going to go out in the streets, drink under a bridge with your friends, you know, or smoke pot, or, you know, overdose on Oxycontin. That's what we see constantly, all throughout, you know, different neighborhoods, white, black, brown, yellow, etc. And so I think it's important, I mean, that we treat mental health as a holistic thing, and a lot of that comes down to job opportunities, it comes down to access to education, access to parks and recreation. You know, at this last city council meeting, we had the River Park people talking about building a damn luxury park for the dogs. And of course, they're going to pay into it. But meanwhile, in South Oxnard, we have exposed wires where kids play. We have barbecues that are absolutely disgusting and covered in, you know, inches of scum. You know, the bathrooms are locked. And there are tons of families that want to go there and use those parks. But they're building a damn park for the dogs. That's on their priorities. And so it's really, we have to look at mental health as a holistic matter that, you know, spiritual healing and all that is important. But the spirit itself, the body needs to be fed as well. The body needs to be kept in good condition. So that's just my 2 cents.
Thank you.
I've got my last little report because Elliot and some of the people are here, and I think that in transparency, I need to give a report on the cafe, how I've mingled some of the mission that we're trying to develop here at the MultiCultural Mental Health Coalition, and how Debbie and I, how the cafe is playing this out. Nobody else. Debbie and I are playing this out